everyone, and welcome. My name is Tracy Morton. I'm the Director of Population Health at the National Rural Health Resource Center. And today you are joining part 1 of 5 of a webinar series that we've put together with some of our federal partners to support the state flex programs with evaluation. And today we'll be covering the basics. A little bit about our organization. The National Rural Health Resource Center is a nonprofit organization that's dedicated to sustaining and improving health in rural America. We are the nation's leading knowledge and technical assistance center about rural health care, and our work focuses in the 5 areas you can see on your screen there. As such, we are the federally funded technical assistance center that supports the 45 state flex programs, as well as the rural providers that you in turn support. So we're really honored to be serving in that role and working with all of you in your states. Our organization is dedicated to diversity, equity, inclusion, and anti-racism, and we're dedicated to building a culture where difference is valued. It's how we show up every day to do our work with one another within our organization. It's how we deliver our work out to those that we're working with, and it's how we're looking to make an impact on the world, and hopefully you see that through the work that we're providing to all of you. This project is, as I mentioned, we're the federally funded technical assistance center for the 45 state flex programs. So it's supported through federal funding through FORHP, and we're doing this jointly with the flex monitoring team, which is another federally funded provider within FORHP too. So you can see our funding statements here on this slide. The purpose of this 5-part webinar series is pretty straightforward. It's really to deepen the state flex program's understanding of program evaluation. We realize that there is a lot going on within the state flex programs, that evaluation is a constant need and is a constant cycle within your flex program work. And we're coming up on a pretty important time to be prepared and understanding evaluation. So we thought this was very timely to put together to provide to all of you. What you can expect in this webinar series is, again, 5 parts. Each webinar is 60 minutes, usually in the afternoons, and you can see the dates down below there. In those presentations between the center and the Technical Assistance and Services Center, as well as the Flex Monitoring team, will working together to provide an overview real briefly about the topic of the day. And then in the latter part of the webinar, we'll dive into conversation with all of you to answer questions you might have, but also to work to apply what it was that we're talking about that day. So today, again, is about understanding the basics. Then at the end of this month, we'll be looking at a little bit of theory, the theory of change, and understanding a practical tool to apply modeling out what your program can look like through a logic model. We'll then move into a little bit further designing and accessing and analyzing data to make those decisions for your design, and then applying that into designing activities, describing outputs and outcome measures, and then wrapping up at the end of January to help you design measurable outcomes that really demonstrate the impact of your program. So that's what's coming. Look for those calendar holds. We'll be sending them out as the dates approach. But also, if you feel like you're maybe missing one too, you can reach out to us at TASC@ruralcenter.org, and we're happy to get those holds onto your calendars for your state flex programs. This content is not applicable to your hospitals or to your rural providers. It's really designed for the state flex programs who are writing the work of what it is that you do within your program. And this all ties back to the core competencies for state flex program excellence, to which there are 10 of them there on your screen. These were designed by the state flex programs along with the other federal partners and the Federal Office of Rural Health Policy. And today, what we're focusing on really is looking at 3 of them. Well, actually not just today, through the whole webinar series, and that's managing the flex program, planning strategically, and managing information and evaluation, which is actually where we'll really focus today. So with that, I'm going to turn things over to our partners at the Flex Monitoring team, John, Gale, and Megan Lahr, to kind of get us going with today's content. And John, just let me know how you'd like me to advance the slides, and I'm happy to do that.
Oh, you're on mute, John. Nope, John, I think you're on mute still.
There we go. Sorry. You'd think we wouldn't waste all this time on mute buttons after so many years, but thanks everyone for coming. We've got 4 basic purposes today, and Megan and I will just cover some of the materials, but we want to discuss the context for evaluation planning and the role of evaluation in supporting the work that you all do. Describe an outcome-based evaluation, describe basic components, and review the key measure, the differences between process and outcome measures, which are all important skills. Next slide, please.
Yeah, thanks. So John, so as this kind of ties in, like I was talking about before, the core competency about managing information and evaluation. Underneath each of the core competencies, there's a set of proficiencies, which you can see as a separate bullet points on the slide. So today we'll really be kind of honing in on that first one highlighted in yellow about utilizing a framework for program evaluation, understanding the evaluation basics and definitions, part of the title for today's event, and then utilizing process measures and short and interim and long-term outcome measures to assess program progress and plan for the future. So I think before we dive any deeper in today, we're actually going to put up some polling questions. So some of these will be familiar to the state flex programs. You can see them on your screen there. These are the pre-polling questions that we ask before any of our webinars. As part of our evaluation, we encourage you to do this too if you're doing any kind of event that is providing education out. So there's a couple polling questions first about your understanding related to supporting project reporting activities, your knowledge about outcome-based evaluation, and your knowledge about the difference between process and outcome measures. So take a minute to answer those, and then we'll look at the results real quick and then move along. So it looks like, from what I can see about folks understanding about the role of evaluation in supporting their program activities, people are either confident or moderately familiar with that. About understanding folks' knowledge about outcome-based evaluation. This one maybe is an area for improvement. Some folks are feeling confident, more in the area of moderately familiar, and then some that are feeling slightly familiar. And then lastly, with understanding the difference between process and outcome measures, kind of similar to above, where there are a few people that feel really good in this area, some that are really feeling unfamiliar in this area, and then kind of a chunk in the middle of competent and moderately familiar. So we will see what we can do to change those scores today as we move along. Can you put up the next set of polling questions, Caroline? So these are really today to help us understand a little bit more about where you're at, where you're coming from. So the first question that we really would love your participation on is, what are the biggest challenges for evaluation for you or your flex program? And you can select all that apply here. So take a minute and think about this. Don't just check them all because you hate it or whatever it might be. But what are things that are really challenges for you? Is it staffing? Is it time to dedicate to evaluation? Accessing data, monitoring data, knowing where to start? Or maybe it's knowledge and training, or understanding a plan that somebody else wrote that you're kind of coming into. So take a minute and answer that question, and then we'll look at the one down below. Okay, so for the first question, I can see a couple questions or answers coming in, so please do continue to answer these. But it looks like for the challenges, the biggest ones appear to be accessing data. And we'll have a webinar about that, about knowing where to start, which is what we'll be talking about today, and absolutely next time on the 30th, having that time to dedicate to evaluation. That's, I feel you on that. That's a struggle here for us at the center too, and it's just something that we have to like hardwire into our projects at the end of them or during them. And then another big challenge, it looks like there with 10 votes, is just understanding an evaluation plan that someone else wrote. So the second question, I can see some of you responded to this already, which is great, is does your state flex program utilize a framework for performance or for program evaluation? It looks like most are saying yes. And then the next highest amount is you're not sure. So certainly something to go investigate as well. And then the last question was, how often does your state flex program share information about your program with key audiences like your staff? Or outside to rural providers, partners, funders, or policymakers. And it looks like the majority are either sometimes or often are sharing information out. A couple of you said always, that's excellent. 4 said rarely, and a few are not sure too. So again, something to investigate. And this is just great information for us to know as we continue to design the remainder of the webinars for all of you. So with that, thank you for participating in those things. And I'm going to flip us now along to talk more about the importance of evaluation.
So Laura, I'll let you jump in on the announcement of your piece of this slide.
Perfect. Thank you so much, John. Hi, everyone. So you're all probably tired of us saying this. I know you've heard us say it for many, many months now, but I'm going to touch a little bit on the importance of evaluation from our FORHP standpoint. It is going to be an important component upcoming in your NOFO that will be available in December, right? We've been talking about this for a while, and I want to say this isn't just a a flex priority, or just even like our division priority. This is FORHP wide. We're really working on a data strategy that we have for all of our programs. And we're really trying to find the ways to best tell the story of the work that you're doing, right? All of the information that you report back to us, it goes to our senior leadership, we tell it to Tom Morris and all of our regular check-ins, but it also goes up to Congress and to the legislators so that we can show the importance of what the program is doing. So we're making this a priority, FORHP-wide, office-wide, and it will be a part of the NOFO coming forward. But that being said, I just want to acknowledge that as you saw in all those polling questions, we're all in different places when it comes to evaluation and experience when it comes to evaluation. And I know I'm not an expert by any means. I think there's probably 5 people on this call that we could probably count as evaluation experts, right? But we're not going to throw you to the wolves. That's what we're here to help with. So at any point, if there's questions on how do we need to write this in the work plan, things about the NOFO, you can call us at FORHP. You can always call TASC and all of those good things. So I think that's the end of my spiel. I'll kick it back to you, John.
Thank you, Laura. So just a couple of key points. That evaluation is just critical to being able to track your activities and see where an impact is being made. It's a core competency of the Flex program, as Tracy mentioned earlier. It's an integral part of program management and improvement. And this is the piece that we'll touch and spend more time on as we go. It can really be a tool to help you inform your organization, the actions of your organization, changes to your program. And finally, when it comes time for PIMS and your annual reports, it allows you to document your outcome and support your program reporting, your performance reporting requirements. Next slide. So here are the basics, and I really liked the way Tracy tied together the 3 components into one, because evaluation really should be integral to your program planning and development. It starts at the beginning, and it's really a continuous process that it begins with identifying needs and challenges and gaps in a very specific way, and continues through implementation of a project, and finally through the end to the completions. I'd like you to not think so much about evaluation as an after-the-fact project evaluation, but really as a day-to-day project management tool. And you can use it to determine impact by measuring where you are, that's your baseline, where you've been and where you want to go. And we'll cover some of those components. Next slide. So for those of you who are grounded in quality improvement and continuous performance improvement activities, evaluation is essentially a structured PDSA, plan, do, study, act cycle. And if you do this from the beginning and you begin to look at the fundamental components about training and education, bringing people together, implementing programs, that you really should be doing this along the way. So as we've seen with many, many Flex applications over the years, things change between the time you've written your application and perhaps the time to implement comes along. And the most recent and best example of that is COVID-19. It threw all of us for a loop. It upset a lot of your programs, changed the way you had to do things. But by having this process in place, you can then begin to make the mid-course corrections that are necessary. Next slide. And this is one that I think, to me, is very important because it requires attention to the causal logic, this theory of change. Too often when we and that's all of us do this from time to time, we come up with some ideas, we think we're going to do this and the outcomes are going to happen. So we do stuff and things happen. But it's really important to think about what's the logic for your program design? What are the steps to get there? It's important to have an end goal and an end object and end expectation. But what are the steps to get you there? Think of it a little bit like a map. You're starting out from your home. What turns do you have to make? Somewhere along the way, you might have a detour that causes you to change where you're going. But it's really a step-by-step process. And to me, this is essential. And so you want to look at how each component of the program helps to establish an if-then relationship. If I do A, then B should happen. If I do B, then C should happen. Sometimes you do A and B doesn't happen, so you have to step back and look at it. So you want to really think through that theory of change. And that really does mean understanding the program interventions that you're suggesting. Now, if you're working with a consultant or an outside group, they can help you with that. And does the theory and the logic hold during implementation? Next slide. So if you look at an outcome-based evaluation, it aligns your strategies with your outcomes. And these are critical. This is a hard process. It's really thinking it through. You want to look at the impacts, the benefits, the changes to program participants. It's important to measure their participation, their differences, their changes in knowledge, but you really want to know how it changes what they do. And you want to look at these changes in the short, intermediate, and long term. And if you think about a 5-year funding cycle, the long term may be at the very end of your cycle, if not longer. So the real focus should be on the short and intermediate steps that uses an evidence base to move you forward. Gives you a chance to improve your program operation and performance. We've all proposed things that have changed along the way, or the needs change. And so this really gives you that information to make the adjustment. And again, talks about program outcomes and impact. Next slide. So here are the questions I think that you really want to ask yourself as you think about an outcome-focused evaluation. The why. What's causing? Why are the why do we think the projects and the sequence of events will have the changes? What do we know about the evidence for what we're proposing to drive change that we seek? The how questions: how is it going to work? Is there a sequence or process that leads to successful outcomes or not? Revenue cycle management is a good example. You start by checking the coding, making sure they're capturing their charges, that they're submitting their claims correctly. And it doesn't really help to do these things out of order. It's a compliance and accountability question for all of you as grantees to report back to the federal office. Did the activities take place and as they were planned? And if they didn't, what does that mean for achieving your goals? And finally, if you did follow it as anticipated, what are the consequences? So it's really why, how, compliance and accountability, and process implementation. Next slide. So it's a stages. I think of evaluation, in pre-implementation, this is when you really ought to be thinking about your needs assessments. What tasks are you undertaking? What are your interventions and setting your goals and problem formulation? If you don't do that at the beginning, it's awfully hard to do that later. So this is a fundamental piece of the process. Next step up, as you implement programs, are these things being implemented as you expected? If you expect hospitals to participate and they don't show up for meetings, then that tells you something. Then finally, refining the program and that PDSA cycle. How do you improve operations? Are your short and intermediate term objective outcomes showing that you're moving towards the objectives? These are stepping stones. And finally, at the end, your summative evaluation, measuring the change in the effectiveness of what you've done. Next slide. So key terms and components, problem definition, and this is an essential part. You want a clear statement of what the problem is, why it exists, and who it affects, because it's really going to drive your. If you don't define the problem clearly, you may implement interventions that are not going to achieve your goals. What resources do you have that go into making your program work? And that includes financial, staff, technical assistance, perhaps consultants, all of those pieces that go into that. Then your strategy, the approach you're adopting to address defined problems. There are some, like revenue cycle management, that really lends itself to that stepwise process. Some of the quality improvement activities, even population health can do that. And finally, what are your activities? And it's a specific action taken to produce a result. You may not be able to measure long-term outcomes, but excuse me, you may not be able to measure an outcome associated with certain things like network meetings, one-time webinars, but you should know how they fit into this work. Next slide.
Yeah, so actually, I think what we'll do is we're going to pause here a second and put
Okay.
up a couple other polling questions just
Absolutely.
to check in on people's understanding of these definitions. So on your screen there is a set of 3 questions, and we're looking for you to describe the definitions of each. So the first question is, an input is either a used to measure an activity that occurred, stepping stones move to move forward, or an input is a resource that goes into a program. The second question is, a strategy is a result from completing program activities, or it's an approach adopted by a program to address defined problems. And then the third question is, an activity is a specific action taken to produce a result, or an activity is a clear statement of what the problem is and why it exists and who it affects. So take a minute, answer those. Okay, so an input is a resource that goes into a program. It is something you put into something. A strategy is an approach that's adopted by a program to address defined problems. And an activity is a specific action that's taken to produce a result. So thanks, everybody. Okay, John, back to you.
Thank you. So we'll get into the really meat of some of our definitions, the outputs, and the outputs are always a challenge. These measure that an activity has occurred. They're stepping stones to use to move forward. And they're really part of a component that says, all right, well, this is how it's really about implementation. If we're setting up a lecture series or informational meetings to help help CAHs improve quality metric. These are the things, did you bring them together? Did they participate? Did they learn something from the session? Did it change their knowledge? And so these are outputs. The outcomes are measurable changes resulting from an activity or a series of activities. So in that same example of using the quality improvement program, say you're trying to improve the emergency department transfer communication measures. What are the steps that you're doing to help them with that? And can you show, are there bite-sized pieces of that you can look at and say, well, if we've done this, maybe they're collecting information better or doing these sort of things. And this is what you're measuring. How did your activities drive some of the change? In targets, you want to make things measurable and doable. And it's why I always suggest that folks start to think about this from the very beginning. So many programs get off the ground and what they're proposing to measure isn't possible from the beginning, and you're better off knowing that. So it's, say you're looking at a number and percent of participants that are expected to achieve desired outcomes. And finally, your indicators. What are the measures that you can see the step-by-step along the way? And that map analogy works perfectly. You know you're leaving home, then you have to get to a certain point to pick up the highway, then perhaps you need a place for gas and food or whatever. So these are the observable milestones that if you're achieving those, even if you can't measure the long-term goal, you know you're moving in the right direction. Next slide, please. So again, looking at outputs versus measures in this bottom graphic, I think is helpful because at the process level, it's where you combine your inputs and activities and outputs, making sure that folks are participating, you're implementing it as expected, and then moving to the outcomes that can, if you do A, then B, then C. So the outcomes that you use to monitor program activities, you want to know how many CAH personnel are attending your financial training. And as Tracy and our colleagues at TASC do for every one of their sessions and webinars, they measure what did people know at the beginning and at the end. So are there improvements in knowledge? What are the percent and number of participants who improved and then applied knowledge? So those are outputs. And I will be fair to say that there are that difference between the higher level outputs and the lower level short-term outcomes can be a little bit blurry, but think about it as something you can measure that's showing real change. And again, the outcomes are monitoring participants, benefits to participants. So you might have a % improvement in CAH margins if you're looking at revenue cycle. Is there a % reduction in days in accounts receivable? Next slide.
Yeah, so let's put up a couple more polling
sure.
questions again about definitions, but looking at outputs versus outcomes. So the first question there is, an output is used to measure an activity that occurred, it's a stepping stone used to move forward, or an output is a resource that goes into a program. And then the second question, an outcome is a measurable change resulting from an activity or series of activities, or an outcome is an approach adopted by a program to address defined problems. I'll give you a minute there to respond to those. Okay, so it looks like you guys are really great. So an output, yes, is used to measure that an activity occurred. It's that process. It's a stepping stone used to move forward. And an outcome, ding, 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 100%. That's great. An outcome is a measurable change resulting from an activity or series of activities. So thank you, everybody, for playing along there.
So the goals, this is the big picture. This is the big picture goal that you're setting, that you're trying to achieve through the project. At the end of the day, it may be improving financial margins. Percentage of hospitals reporting improved financial margins. That's a big step, and there are a lot of things that can go into that, and there are a lot of things that may impede your progress towards doing that. But it's always important to have that big goal of where you're headed. Then the objectives, as we've mentioned, are small and measurable steps. They should be specific, easy to measure, achievable, realistic, and time-bound. And we shouldn't forget that you really should be able to identify upfront the data that's going to let you prove that. The objectives should always support goals, so it's important to set your goals first. The objectives are a daily act. They play out daily and they translate into action, and these are the things that you want to be monitoring along the way. And it may be possible you've done everything right. And because there are changes in the environment of the hospital, financial could be a change in Medicaid reimbursement. One of our critical access hospitals that we worked with, the major employer in the community closed the day they got their notice of CAH conversion. They lost almost all of their commercial insurance volume. That they didn't achieve their financial goals, but they were moving in the right direction. So these are the critical pieces. Next slide. So improvement, it's a change in the outcome that was a target of the project in a positive direction. It's not improved by increasing participation, but rather you're seeing positive changes or reaching your goal. An impact is the result or effect that contributes to your project or program. It's often used to refer to higher level effects of a program that could occur in the medium or long term and can be intended or unintended, positive and negative. Not everything works the way you planned, and it's okay that that happens, as long as you can recognize it soon enough to make mid-course corrections. Next slide. And as I said from the beginning, and this may be redundant, but I think it's so important to understand that this is a management tool for all of you. You've got to really start with the planning phase of the project and integrating evaluation from the very beginning, consistently tracking information throughout the course of the project, outputs, data, and outcomes, and keeping your work plan updated. If you make changes that are necessary because of a change in your environment or different expectations in terms of implementation, it's important to update your work plan and your goals. You may have to change things sufficiently that you'll need to revise your outcome measures. These are all the things that you should be doing throughout the course of your projects. And finally, using that information to modify the project as needed. this is a not unusual component of program management. So being able to collect that information. So that argues for making sure that your information is easily accessible and the data you need, and you can measure this as you go rather than waiting for 6 months to a year down the road. And we'll cover some of those issues in subsequent webinars. I think this is the last slide. So again, looking back at this, it starts with your assessments, in finance and quality and some of the other activities, EMS, population health. It starts with understanding the nature of the problem and your strategic planning. How are we going to make a difference? That generally should involve input from the hospitals or the EMS agencies and the participants. Then designing your strategy interventions. How will I be able to put these pieces together to achieve your priorities? Implementation monitoring, process monitoring. This is really the bulk of your evaluation work. Dated, month to month. Are you collecting this? How are you finding? Can you get information from your participants that can be used to do this in real time rather than say waiting for the cost reports in Compass? Then finally is summative evaluation. The end of the day, did we achieve what we wanted to, and being clear about that. Next slide. Questions for anyone?
Are there any questions that anyone has? We can certainly field some for a bit. Otherwise, we do have something to move into next on the activity, but any questions anyone has? Okay, if not, we can answer those in the breakout session too. So I'll let you know what's going to happen. We're actually going to stop the recording and we're going to move into breakout room conversations. And here is the plan. So we'll be shuffling into about 4-ish or so breakout rooms that'll just be kind of randomly set up. And in each of those rooms, there'll be someone there from the center or task or from the flex monitoring team that'll help guide you through a conversation. In those, like I said at the beginning, what we really want to do is kind of apply what we talked about today and answer any questions that you might have. So the reason that we're going to stop the recording is that we want to have an open, candid conversation. We want you to feel like you're in a good, safe space to do that. There are no questions that are dumb. There are no questions that are elementary or that are repetitive or anything like that. The purpose is really to help you feel successful in this area. So please do ask the questions and engage in the conversation. With engaging, we do want, microphones on to have a conversation. And unless there's a problem, then certainly use the chat function and turn your camera on. We're not going to see each other all in person until July. So it'd be really nice to see what you all look like again, so we remember. And just, again, it'll help support the conversation. So we'll be moving into breakout rooms for about 15 minutes or so. And then we'll come back into this space to kind of wrap up at the end, ask a couple more evaluation questions of you, and then send you on your way with what to expect next time. So we will talk to you all in our breakout rooms now.